Hello, I'm Senator Patty Murray from Washington State, and I'm really excited to be here today to take questions from readers at Moms Rising. The first question asks, will health reform legislation include funding for CHIP? The answer to that is yes. Back in January of this year, this Congress reauthorized the Children's Health Insurance Program to provide coverage for children across the nation. We made sure that the 6 million children already on the program were kept there, and we added an additional 4 million children. So today, 10 million children are covered under the children's health provisions. In the health care bill now before us, we make sure that that continues all the way through the coverage of this bill. And over time, as many of the provisions of this health care legislation go in effect, fewer children will not have access will have access to insurance that don't today. So the program will maintain that coverage for all of our nation's children. The second question is, what ideas do you have for making children's health insurance coverage more affordable and tailored to their unique developmental needs? You know, the health insurance bill that we're considering today makes a really great stride in making sure that children get better access to health care. A lot of kids today don't get access because they don't have access to a primary care physician, or to a pediatrician, or to a family care doctor. Within the health care bill, we put in some really strong provisions to provide training and help for people to go into those professions so that more people have access to those doctors. We also have some really strong provisions for community health clinics, so children who are in rural communities or who are in communities where there aren't good access to doctors will have access through community facilities. There's a lot of provisions in the health care bill that are directed to make sure that our young children get the care that they need. The next question is, will most of the provisions in the health care bill begin in 2013? Well, as you have heard, some of the provisions don't take effect for several years, and that is because we have to set up those and do the regulations and get them working. But we've made sure that a number of provisions go in place immediately. For example, we take away the lifetime caps that insurance companies now have. I've talked to young families who have a child with a severe disability or are diagnosed with cancer early in their lives. Tremendous health care costs over the lifetime, and they soon find out that their health insurance that they've been paying for a very long time has a cap on it, and all of a sudden they go bankrupt trying to pay for that extra cost. Immediately, we will make sure that children and all people don't lose access because of those caps that insurance companies have today. Another important provision for families today is that children immediately will have access to health insurance through their parents' insurance all the way through age 26. Talk to a lot of families who kids go off to college or to after-school work and don't have access to health care because of their age. This makes sure that you keep on your parents' insurance all the way till you're 26 and have the stability to get into a health insurance program. The final question is, how will health reform help working mothers who don't have health care coverage through their employers? Well, this is what's great about this plan. What it does is it sets up an insurance exchange where insurance companies have to offer you an insurance plan. They can't deny you because you have a pre-existing condition or how much money you have or where you live, and you will be able to go online and look at the insurance company's plans that are offered to you and choose one that's best for you. And if you are lower income at 400% of FPL or lower, what you will be able to do is get a subsidy to help you buy insurance on that plan. So people today who are denied insurance because they don't have coverage, or they have a pre-existing condition, or they've reached that lifetime cap, or they have an employer who doesn't provide care, are all now going to be given an opportunity with subsidies if they're low income to provide health care coverage for themselves and their families. Thanks to everyone at Moms Rising for great questions. And if you do want more information on my work on behalf of women and children and families, be sure to visit my website, murray.senate.gov, and we will help provide you with answers to your questions.